Welcome. I am Senator Tom Sherman from District 24. Today we will be conducting a regular meeting for the Commission to study environmentally triggered chronic illness. Before we get started, I'll read through a checklist to ensure that the meeting we are holding is in compliance with the right to know law. As chair of the Commission to study environmentally triggered chronic illness, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12 pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which is authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that we are providing public access to the meeting by telephone with additional access possible by video or other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. And the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube and via phone by following the directions and links provided in the general court website. Number 2. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. Number 3, we are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate@leg.state.nh.us or call 603-271-3043. That's 603-271-3043. In the event the public is unable to access, the meeting will be adjourned and rescheduled. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. And I will call the roll. Will somebody, Nancy or Jeff or somebody, please just jot down notes. This is being recorded, correct, Alan?
Yes.
Okay, so we can go back and get minutes off of the recording, which is what we've done in the past. So calling the roll, Representative Jeff Soloway.
Here.
Representative Gary Woods.
Here, I'm at home and alone.
Representative Bill Nelson. Representative Nelson. Representative Charles McMahon.
Good morning, sir. I am present at home and alone.
Great. Representative, let's see, me. I am home alone with my, well, actually we have other people in other rooms, but I'm the only one in this room. I'm in Rye, New Hampshire. Senator Bradley. Senator Bradley. Dr. Bush.
Morning, I'm here in my office in Concord and have one colleague in the far corner of this office as well.
Okay. Mike Wimsatt.
Yes, good morning. I'm here in my office in Concord and I'm alone.
Amy Costello.
Hi, I'm in Dover, home, alone. People are in the other room.
Okay, Dan, you're going to correct me on this. Dan Zizek?
He's not able to make it today.
Oh, okay, great. Oh, that's right.
Military commitment.
Nancy Murphy.
Here in Merrimack, in a room by myself, but with a house with many other people.
Okay. Robert Timmons. Robert Timmons. Margaret DiTullio.
Good morning, present in my office in Atkinson, New Hampshire by myself.
Great. Mindy Mesmer.
Good morning, in my house in Rye, in an office by myself.
Okay, are there any commission members I missed? Great. All right, so let me pull up the agenda, which I have somewhere semi-handy. So we have had one glaring deficiency as a commission, and that is a reliable and elected clerk. So we need a clerk as a commission. So what I'd like to know is, are there any volunteers? Or better yet, rather than doing volunteers, let's do nominations so that, and I would nominate somebody here rather than doing what I usually prefer, which is nominating somebody who's not here. Do we have any nominations for clerk? Yes. Gary.
Nancy Murphy.
Second,
Oh, perfect. Nancy, thank you so much for your willingness to serve. Are you willing to do it?
I would really rather not. I am very technologically impaired. So I will have to look at videos and rewatch them and write them from there because
that's a good thing.
I have no keyboarding skills and I will have to handwrite everything. So I would
Okay.
really rather not, but if nobody else will do it, then I
Oh,
guess.
please, please, Nancy.
You will have tons of assistance from Representative Soloway and Representative Woods, who are really facile with keyboards. I saw that, Representative Soloway. Would you mind being the official clerk, and then we'll figure it out as we go? Nancy?
We will come back and revisit this.
Yes, we can come back and this can be like a one-year term or something like that, or whenever you cry uncle.
Okay.
I want to first recognize that Bill has joined us. Bill, we went through the roll call. Can you say you're here, your full name and where you are and whether you're alone or not?
Can you hear me?
Yep.
Okay, my name is Representative Bill Nelson, Carroll County District 5. I'm operating from the Brookfield Town Office Building. And at the moment, there's nobody in the building with me, but there is somebody in another room that can listen to our meeting. It's the town clerk.
Okay. Can she take notes and help me?
No, she's registering cars.
Sorry, I tried, Nancy.
Thanks.
Okay, so we have a motion on the floor to honor Nancy Murphy. This is how we welcome people back to the committee when they shift from being a state rep to being a member. We give them a job.
So much.
I think we have to do this by roll call. So let me go back to the roll call. All right. Is there any other discussion? Okay. Representative Soloway,
Yes,
Representative Woods,
Yes.
Representative Nelson,
Yes,
Representative McMahon.
Yes,
I vote yes. Senator Bradley is not here. Dr. Bush,
I vote yes.
Mike Wimsatt,
Yes.
Amy Costello,
Yes.
Margaret DiTullio,
Yes,
Mindy Mesmer,
Don't call me Nancy, yes.
and Nancy, you get to be the only, well.
Can I abstain?
That's so funny.
Yes.
Okay. Thank you, Nancy, for being willing to do that. And of course, everybody will support you in this endeavor. It might be something where we could take donations and get you voice activated, so you can just play the tape and have it transcribe as it goes. That's what we do at the hospital.
There you go.
All right. So next order of business is minutes from the last meeting.
motion to approve.
Is there a second?
I'll second it.
Okay, so that's Representative Soloway with the motion to approve, Representative McMahon with a second. And Nancy, the good news is all this is being recorded, so you don't necessarily have to take any particular notes right now. Is there any discussion or corrections in the minutes? Okay, seeing none, we're going to do another roll call. Representative Soloway,
Yes,
Representative Woods,
Yes.
Representative Nelson,
Yes.
Representative McMahon.
Yes.
I vote yes. Dr. Bush,
Yes.
Mike Wimsat,
Yes.
Amy Costello,
Yes.
Margaret DiTullio,
Yes.
Mindy Mesmer,
Yes.
Nancy Murphy.
Yes.
Great. And I'm not missing anyone, right, on that? Okay. So what I thought we would do is get updates from the data and education subcommittees.
Yes.
I know there were meetings. So can we start with, should we start with data? Who is the spokesperson for the data subcommittee?
Yeah, well, I think we're going to take some turns. At our last meeting, we actually elected Dan Tizik as chair, but then he conveniently couldn't be here today.
Yeah.
So I know he has other obligations.
Nancy,
So I
don't
think
throw
we're
it at
gonna
the clerk.
take some turns. I think was the plan. We have a few products we'd like to share.
Right.
Let me see. And so we have met twice since the last full meeting, one on November 17th, where we reviewed what had been sort of a draft report that I think we talked a bit about last time, and really wanted that to just be sort of a summary of our work to date. So we do have that, which we're willing to share and can certainly circulate and put on the website after today's meeting. It draws largely on previous final reports from either the 511 Commission going way back or just from the bill text generally. And the big piece that we're working on as part of that is a conceptual framework, which I think I'm looking for nods. I think we wanted to share with the group this morning. Should that be maybe the first product that we sort of share?
Katie,
And
can you refresh our memories who's on the subcommittee?
Sure, yep. So it's Dan Tizik as chair, myself, Mindy Mesmer, Nancy Murphy, and Amy Costello.
Great.
And then what I'm going to try to do now is show
You
you
have-
this conceptual framework that we've been working on. Can everyone see this?
Yeah.
So we just thought that as we were going through our work, really trying to create some buckets, right? We have many, many charges to this commission, and sometimes it's helpful to create different buckets to help organize our work and our thoughts and our recommendations. And so a lot of the group discussion has focused on sort of what are the appropriate buckets, and we've landed on this. And so I think we welcome some feedback, but let me first walk everyone through it. And if I go like this, maybe it will be bigger. Sorry, is that better now? Is
Yeah.
that big? So the first bucket is monitoring and surveillance. That's just some of the key work we've talked about in terms of identifying relevant programs, databases, and disease outcomes of interest, right? That we may want to track, sort of what are the data gaps and what exists to help fill those gaps. Also reporting. So a big part of the work of this commission is to understand data and information that already exists, but then also to maybe think about how we improve reporting of things that maybe currently aren't being reported on. A big bucket you can see, and I think this dovetails with, I mean, this is all the work of the whole commission that we've tried to put into buckets, but the education subcommittee, I think, would really focus here on the communicating part. But we've talked a lot about sort of two-way communication between agencies and the public and the legislature, I guess a three-way communication. So both sending information out, but then also using that information internally within agencies or within government to guide programs and priorities. And then we did just build out this section here, the fourth bullet, to really highlight the importance of working with healthcare providers. So I guess there's sort of broad communication, but then some more targeted education and outreach. And then this whole capacity building bucket where we can see the different charges really related to standing up systems like IT systems to allow for data interoperability, but also standing up things like processes to guide our work or necessary policies. And then we have these sort of cross-cutting topics down here around collaborating and regularly communicating with all stakeholders. And then this this new bucket, this is the bucket that really we have spent a lot of time discussing as a group, that we see as sort of a gap in the work that we've done to date, and really, I think, a priority going forward, is how to create an effective, responsive community engagement process where we evaluate current tools and protocols to engage communities, where we then use data and information and input from community members to guide our work, and then use all of that information to sort of revise protocols and communicate about risks and findings. So I think, again, that's a very, while it's in the lower left corner, a very cross-cutting theme of our work that we're going to continue to focus on, that really touches on all the other 4 buckets. So I'll pause there and just see if anyone else on the commission wants to add anything, on the subcommittee, sorry, wants to add anything.
One thing that occurred to me late last night, later than appropriate to add, is that I wonder if the community engagement process could actually somehow in this schematic go across the top to reflect sort of, you know, this interactive community engagement process through all of these things. I know it's just, it looks like just a exercise in formatting, but I think there's something about having it at the top, you know, as being sort of in line with the philosophy that has come through the work of the data subcommittee and responds to the charge in the bill.
I agree. That's a good point, Amy. It was a technical challenge to get that box in there. So I just pasted it in because I couldn't figure out a better way to do it. So if anybody has more.
No, it's not a comment on formatting at all. It's just a, you know, like philosophically.
No, it's true. Yeah, no, that's
something that we want to do. And I think the foundation is the collaborating with local, state, and federal partners and routinely monitoring and communicating, you know, so, you know, it's a minor thing, but I think the spirit of it can be conveyed by putting it more at the top as opposed to, you know, a 5th bucket or at the bottom. And ask a student to help with formatting if that's something that we agree to. But
and I think it's also important to note, right, the original buckets where we have the parentheses, those reflect the actual charges of the bill. And so I think almost that the community engagement process is sort of our distillation then of all those charges, kind of our marching orders or our action items, right? These are the things now based on kind of all the other buckets and all the other bullets. These are the things we want to focus on and that we hope the commission will take on as well as sort of how we take all of those charges and now what is it exactly that we're trying to create, trying to develop. So I think whether it's our overarching goal or the overarching problem statement, I agree, it can kind of be our guide. So other thoughts from either the data subcommittee, since we just were iterating over this over email recently, or from the larger commission?
I would agree with Amy's suggestion. I think that's a great idea. You know, when I was looking this over, I was wondering if under the communicating column, the first item, getting information from concerned stakeholders. Who are we including within that? Are we including the public in that, or is this more public health or I don't remember if we clarified who that was.
Well, and these all are just excerpts of the original bill text. So I was gonna pull that up. Sorry, I'm still sharing my screen, I realize. So number 1. Yeah, I'm not sure. I think it probably varies, right? I mean, I think it depends on the topic. It probably depends on exposures we're talking about, right? I think that's what we recognize, at least within the health department, is there can be a multitude of stakeholders sort of depending on the current topic. So if I go back to the report, so people have this in their mind. Sorry, I have a bazillion things open. But when we look at the report as well, oops, I pulled up the wrong one. We also, I think another big point of discussion, I'm just going to zoom down to the bottom here, is we tried to summarize some suggestions for future presentations. So that was something I just wanted to make sure that we noted here in this setting in thinking about future presentations or future testimony, not exactly sure what we call it, and whether these would be relevant to the full commission or suited to the data commission. But some specific suggestions are to invite representatives from HHS to present on their enterprise business intelligence system, which I think Amy could speak to as well, the sort of new data platform that the agency is moving towards.
Yeah, I would, and just to be clear, just to clarify, Katie, I would not present on that, but I would coordinate to get the best presenter on that.
Yes, and then we thought also, and as a registry of outcomes is often something that we talk about, perhaps taking a more targeted approach, thinking about specific registries. And so there has been talk internally around the birth defects registry. So I thought a presentation from the maternal child health section on the birth defects registry, which had been federally funded. That funding was cut. I think they're currently writing a grant application to refund some of that work, but to hear from them about the work that they've done historically and maybe the work that they hope to do in the future. I also thought we thought a presentation from the biomonitoring program, of course, once their trace study results are out. And similarly, I've sort of on the opposite side of the house here, DES has a great project, a well water project, statewide project, where they've sampled something like over 500 wells. So similarly, when those results are out, I thought that would also be a worthwhile presentation. And so again, the people in the parentheses are meant to be sort of the liaisons, not necessarily the presenters. And so, yeah, I guess just any feedback on either our conceptual framework or these suggestions for presentations at future meetings.
If I could ask a question, Katie, on these presentations, I mean, these are great topics and they all pertain, you know, when I think of our different charges from the bill and now in the statute, as we get these presentations, would the idea be that we would then think about how we connect that with, you know, the two buckets, the bucket one being chronic disease, the other bucket being environmentally triggered? Are we getting these presentations with the notion that how do we look at this from the unique framework of this commission? Or are they, I guess the way, putting this in some context, the DHHS Enterprise Business Intelligence and Biomonitoring Trace Study, these are databases, is that correct? And then the birth defects registry might be a database regarding chronic or the birth defects, but on the flip side, we might be thinking about what is also happening in the areas where we're seeing these events from an environmental standpoint, getting back to our idea of superimposing chronic illness over, or what is the environment in which this is occurring? Is that, am I thinking of that perspective correctly? Is that would be the point of these presentations?
Yes. Yes. So I think there's been a lot of activity with the EBI, and so understanding what the current plans are or what the current state is to be able to support the early detection of emerging conditions that may be environmentally triggered, but then also to understand any future plans so that as we're thinking about filling gaps, which may require legislation or funding, we are not duplicating efforts potentially,
right?
But to understand the intersection of how the EBI might be able to support the detection of the health issues, and whether there's any insight into, potentially incorporating environmental data.
Yeah, I think that's right. So when we think about this conceptual framework, part of our charge is to identify technology gaps. Well, let's hear where they are and where they're going, and either try to advise or try to support those initiatives. And then I think, right, one of our other charges is to improve interoperability of data systems. And the EBI is how, at least in the health department, we are trying to move towards that interoperability. So again, to kind of get a state of the science where we are, and so that we can then determine where we want to go. But I think so that we're going there in alignment. I think that was the thought. Whereas the other two, I think the two data presentations from biomonitoring and DES on the well water, I think that's more to really understand hazards, right? I think we know that there's a large world of potential exposures. And I think these two studies will help us identify what contaminants are out there in the water and also showing up in people, and may help us target our focus to certain exposures based on the data. And with that, maybe it's a good transition actually to talk about the other big product that we then talked about at our second meeting. And I'll sort of hand it over to Mindy. So the other big thing that the data subgroup has started to work on is an inventory of exposure outcome pairs, I'll call them. So different environmental exposures and what outcomes they're linked to based on scientific literature, where we may want to then improve our tracking or surveillance or our monitoring of these.
Right. So one of the things that it is a really good segue. One of the things we initially started talking about too is what databases historically have already been set up, the structures there, maybe not been funded in the last, what are the low-hanging pieces of fruit that we might be able to help push forward again. And so we decided to go back to the NIEHS table that was in our first report from the 511 Commission, and realized that it's no longer available on the websites. So actually is a good thing in a way, because it's going to allow us to go back to the drawing board a little bit and look at what's really happening in New Hampshire, or what we have as concerns in New Hampshire, and sort of recreate it to be a New Hampshire specific table. So we started doing that last week. And so here's the table, the NIH. Can everybody see this? Yeah. Here's the table that was in our first report from the 511 Commission. And here's the table we've now developed to start putting some work into. And for instance, PFAS wasn't on the NIEHS table. And that is a big concern here in New Hampshire. So we're starting to build this ourselves. And so I think actually this is going to be a really good exercise, but we're doing everything from PFAS to radon to lead to MTBE and maybe even some vector-borne diseases that we can start looking at. And one of the things that we realized was probably low-hanging fruit was that the birth registry, especially where we're concerned about the high rates of pediatric cancer in the state of New Hampshire, and now understanding that low birth weight is connected to PFAS exposure, prenatal PFAS exposure. We felt that that was one of the pieces of low-hanging fruit that we could hear about, what is there, what's already been set up, and how we could possibly re-implement that to start looking at the effects of PFAS exposure in the state of New Hampshire, and maybe other things related to low birth weight. So that's just a quick overview. I've just started getting into it. We're all starting to get into it. We set up the structure, and any comments on it are welcome. But we're going to be continuing to fill this out.
Can I just ask a kind of a screwy question? And Mike, you might be the right person to answer this. One of the thinking of the membership of the data subcommittee, I don't think there's anyone from DES on that subcommittee. And my recollection is that we don't necessarily have to have people from the commission. We can invite outside members. I think we did that on other subcommittees and other commissions to at least participate. I'm wondering, Mike Wimsat, would it make sense to have the DES toxicologist or someone else who understands, or you, of course, but I know how busy you are, be a part of the discussions? Because it seems to me this is heavily on the health side, the DHHS side. I'm just wondering if it would make sense to have somebody as a part of the subcommittee who could also be talking about the contaminant side.
Sure, I think that'd be a great idea, particularly as it relates to, how various DES databases could support the work that's just been described. So I'd be happy to talk internally here and figure out who that might be the best person to do that.
Would that be
I'll
helpful?
just say, I think we would welcome that. I do want to just say I work very closely with the toxicologist and with several programs in DES. So also in the interest of people's time, I do feel like they are well represented. And actually, one idea I want to share that I hadn't had a chance to share with the data subgroup yet is DES has a long list of drinking water standards, for example, right? And those standards identify different contaminants. And so that is a very long list of drinking water contaminants for which we have regulations that at some point we may want to then compare to our list, right? It would be a way to further build out this list. And obviously we have regulations for contaminants that we think pose a risk to human health. And so that list was shared with me. And so I think, so that's just an example of that communication is sort of happening in the background. And I want to assure people that those conversations are happening internally. And then, so Mike, you can maybe assess people's availability at this point, but just, I want everyone to be confident that those conversations do happen internally.
Well, I probably jumped the gun, Katie, because I probably should have checked with the data subcommittee, which was sort of what I was doing. But if you all don't feel like that's necessary, I'm a big believer in not asking people to participate in meetings where it's not necessary. But so it sounds like Katie knows who to talk to in DES if they need additional help. And so I will, but my thought was that I wasn't sure whether that was represented on the subcommittee. It sounds like, Katie, with your background and your ties within DES, it probably is. So
but I do think it's good to know that a non-member could sit. I think that's helpful to know. And if DES felt like they wanted to have someone sit, I think that's helpful to know. So.
Okay.
Yeah, and I can circle up with Katie on this. And, it may be that someone like John Alley might participate on an occasional basis in the subcommittee meetings when his expertise and input would be really helpful. So but I'll talk with Katie about this.
Perfect. Sorry, and thank you. Any other information? This is phenomenal work, you guys. This is really absolutely cool. It brings out the deepest nerd in me. And yet it's very sophisticated. Katie, I had a question. You remember back in the 511 Commission, you and I, and I'm blanking on his name from DHHS, who's since retired, wonderful.
Mike Dumond, yeah.
Mike Dumond.
Yeah.
Hopefully he's doing well. But the three of us sat down, we met with Massachusetts people. Jeff, I'm sorry, I'll get to you in 1 second.
No problem.
But Mike, we had talked about how DHHS was in the middle of a lot of work on their data systems. Is that still an ongoing project, or is that reflected in what you've presented today?
Well, so that's really what Amy was speaking to earlier. This EBI, the Enterprise Business Intelligence System, is sort of going to be the new home for much of DHHS data. And folks may remember presentations on our Wisdom data portal, which is really where the public health data sit. And so even that will now be migrated into this new platform. But what's more exciting for those of us who understand barely the infrastructure is that not only will things be integrated on the front end for users to go in and see, but more importantly, really for our purposes, even on the back end, the data will now live on one system instead of in multiple databases all over the place. So the EBI is both a place to house data and then a place to pull that data from the different server spaces and push it out in a uniform fashion. And so that's where I think having an update on that, sort of the status, maybe even their needs, right? I mean, we kind of do things on a shoestring, right? But what could we do with small investment of resources. So I think hearing from folks, and it's our, what's BIS? I'm blanking on the new unit, but there's a new unit within DHHS who's guiding this work.
That would be awesome.
So that is all sort of related to what we are talking about here. And I think the question is really, which of these outcomes and exposures that, that we are identifying that Mindy showed in the table, which of those should then become things that we track on a regular routine basis, report on in a regular routine basis that would be in a dashboard in the future version of this, right? I think those are the questions we're sort of grappling with, and what's feasible to track, in a meaningful way, thinking about things like small numbers or what can we track meaningfully that tells us something.
Okay. Jeff, did you have a question?
No, I'm anxiously waiting for the education subcommittee because it's a perfect segue to Dr. Bush's report.
Okay. If I could ask one last question on data, is and Dr. Bush, I think you are the one who would probably know the answer to this. Is the cancer registry a part of the EBI?
So it will be, right. The cancer data will be one of the data sets that sits within EBI. So, the registry is a big entity with many staff at Dartmouth and here at the health department. So when we talk about the registry as kind of this whole group, but then the data, the registry data, yes, would be another key data set that would be hosted in EBI.
And what about being outside of DHHS? Are you able to incorporate data from, say, insurance or corrections as we had dreamed of in the past?
Well, so Amy may be able to speak to this a little bit more, but I know at least like one of the visions, right, is that Medicaid sits within HHS, but separate from public health. So at least this would be an ability to integrate Medicaid data and claims related to Medicaid, which is a large proportion, but you can maybe speak to Amy, other claims data, the all payer, the larger claims data.
Yeah, Deloitte was on contract to incorporate the commercial claims into EBI. Whether that becomes accessible to the public, I think is a very good question for the presentation. But that work has been done to incorporate it into the EBI and have it available to DHHS analysts.
Awesome.
Medicaid is in there as well. We pull the Institute pulls Medicaid data from the EBI directly.
Okay, cool. Margaret, did you have something you wanted to?
Oh, you're muted.
Thank you. So I have a question. That's a wonderful table that you all put together. My question is it a fixed table or is it a dynamic table? Meaning recently I've had some literature go past me that suggested associations with arsenic and diabetes, for example. And so how would I go about sharing that literature and maybe having that integrated into this document, or is it fixed now?
We're struggling with that right now. We're trying to get it so that it was available to all subcommittee members as a dynamic document. That's what we'd like to do. But we're having some technical issues with that, with people being able to access it. So we're going to work on that. But for now, I would think that if you just send it to us, anything that you want us to see, that would be helpful.
Super.
And I think some of the conversations during the data subcommittee were kind of pointing to the fact that this could become a living document, so that as new contaminants or new conditions were identified, that this table could become sort of the singular resource, so that we aren't dependent on an NIHS table being updated and available online, but something that could be kind of carried forward in perpetuity for whatever SB 85 committee looks like in its future iterations.
I think Rep. Soloway had shared an additional concern, and correct me if I'm wrong, Jeff, but the combustion of natural gas in the home and the connection with asthma.
Yeah.
And so I think that the point that Margaret and Jeff if I can speak for Jeff for a second, are making is that this needs to be a living document, and one that is dynamic and flexible and responds to new data. And I'm not sure whether that would take legislation or whether that would take, whether that's something that can be incorporated into the EPI or some kind of one of Katie's databases or into the MOU between DES and DHHS. But something to think about. Is there, are there more questions for the data committee or is the subcommittee, or is there, Mike, you had your hand up.
Yeah, I don't have a question for the subcommittee, but I regret that I have to step away from the meeting in just a moment. So I wanted to just answer one, just a random question, not random, but an unrelated question that came up during the last meeting about the DES's filter pitcher project for arsenic. I think there was a question about whether we understood those filters to also treat for lead contamination in water. And I looked into that with staff. The answer is yes. The name of the filter pitchers that we're using are called Zero Water. And their website suggests basically that there's a whole host of metals that those filters treat very effectively for, and lead is one of those. So I just wanted to, I knew that question was there, and I said that I would run that to ground for the next meeting. So I wanted to let you know that.
Thank you, Mike.
And again, I apologize, but I'm going to have to leave at this point. So
Okay.
Best to everyone, and I hope your holidays are safe and even if small.
Likewise.
Thanks, you too.
Thanks. Gary.
Yeah, I just had a question about the quotes living document. I'm not, that sort of rings different bells for me in terms of what that might mean. To me, that means more an open database, and I may be wrong. So if someone can help me out, I just had concerns that if it's quotes too open, then too many people can put whatever they want on it, and that ends up contaminating the whole business.
Yeah.
And I had some concerns in that regard, because I can envision some areas which have a very high emotional content, you get flooded with all kinds of stuff.
Yes, I think you're chairing one of those commissions.
That's exactly.
You bring a unique perspective, Gary. I think that's a great point. Is this would need to be managed by. Well, I didn't mean living like anybody could put the data in, but that this would be science-based data under the careful, watchful eye of somebody like Dr. Kathleen Bush or somebody like that, who, or the data subcommittee. It could be probably their baby, to keep this, at least until we understand the best use and the best management and maintenance of it. I would hope it wouldn't need any statutory support. I think it probably is something that could be part of that MOU between DES and DHHS. It would be really a kind of slick way to have it managed by the experts rather than by just anybody. I share your concern, Gary. Any other, did you have a follow-up on that, Gary, or any other comments?
No, I really like the outline that they presented. It's very, very cogent. I don't recall having seen that. Is that possible to share that with the rest of us?
What, the NIEHS one?
Or our
well,
version,
you're-
I think he's asking.
Oh, our version.
I think we'll work to maybe get a more complete version. It's very rough right now. And I think all we meant earlier was that it's not, we're certainly sort of still taking suggestions, right? So Margaret's suggestion, and I think, but we very much, we don't plan to make it public at this point. But I think we could share a version, Mindy, probably as a draft, if people want to just have it and refer to it, but that we definitely plan to flush it out. And we really have only focused on PFAS and some of the known things like radon and arsenic.
Just a reminder to Dr. Bush, this is public, so.
Well, but for editing,
I know what
right?
you mean.
No,
I mean, you don't want to make a formal final report that's, yes, this is a work in progress is what I think you're saying. But this is, yeah, this is a public meeting and. it
But not a
needs-
citizen science data collection tool.
Correct, exactly.
And you'll notice we do have columns in there to cite this, you know, to include the citations of the associations that we are naming. So.
Right. Okay, anything else?
Senator Bill Nelson.
Oh, yeah, Bill, go ahead.
I'm sorry, I'm having trouble with the screen here, so it's creating problems. My concern is there any data collected regarding special education from the special ed department at the Department of Ed to see if there could be, you know, a cluster of people with autism or some other condition that might be in certain parts of the state, higher percentage?
Great question. Katie?
That
do you-
was actually something we did talk about, and that was one of the presentations that I don't think made it on the list, but we thought we wanted this next year because we are concerned about that, and that will also be reflected in the table that we're creating.
So that would be, Mindy, that would be under, in that table that Katie had of possible future presentations?
Yes, it should be, yeah.
Thank you.
Great thought there, Bill. Anything else for data? Okay, and Bill, you did a beautiful segue into education. So let's,
Sorry about that.
Yeah, no, that's perfect. Mr. Chairman, if I may.
of course, yes, please.
I must preface this by saying that I'm having difficulty controlling my excitement at the work that the commission is doing. And the fit between the data subcommittee and the education subcommittee is simply perfect. It does in fact lead us someplace that I, as the chairman of the subcommittee, had never anticipated, but members of the subcommittee drove things in that direction. The subcommittee met on November 17th. There is a report from that subcommittee. It is not final yet. It has to go back to one more meeting of the subcommittee. I had actually thought of posting it on this meeting, but I believe that Senator Chairman is correct. This is a public meeting and it's not yet a final document and probably should not be made public until it has passed through the subcommittee one more time. So I apologize. However, just a couple of brief notes. The committee indicated that there are two major dimensions to mitigating risk through education, one of which is a public health dimension, but the other of which is a clinical dimension. And the question is, how do you get data on risk from sources of hard information into the hands of clinicians? And this means we're building this on a deductive logic, okay? Let's go to the literature, find out what risks are reported, and the subcommittee worked hard to specify that environmental risks vary by region of the state. And we thought, therefore, that it would be extremely useful to enlist the aid of local public health officers as well as DHHS and DES. So I had, at least in my mind, these two dimensions, which were a deductive logic coming from DHHS and DES, i.e., let's look at the literature, let's find out what the risks are of arsenic, of PFAS, and so forth, and then let's take that to our public health officers regionally in the state, find out if they are seeing these risks, and pass that information through the hospitals and the professional associations to the clinicians. It's all built around a deductive logic. However, to my absolute delight, the subcommittee observed that while a deductive logic is pretty standard for implementing public policy, we also need to be alert to an inductive logic. And this for this, I will hold responsible Dr. Tom Sherman and Mindy Messmer. I did say Dr. Tom Sherman and not Senator Tom Sherman quite deliberately. Going back at least 2 years, possibly 3, Dr. Sherman appeared before Health and Human Services and mentioned in his testimony a higher incidence of biliary carcinoma in his clinical region. Okay, so Dr. Sherman, as a gastroenterologist, indicated that he was observing within his practice a higher rate of biliary carcinoma. In the same fashion, the Honorable Mindy Messmer had noted sometime earlier the prevalence of rhabdomyosarcoma and other childhood carcinomas in the Seacoast area, and from this inductively developed an approach to PFAS contamination on the Seacoast. These are inductive logics, okay, where we take data that we see and attempt to build up in search of a cause. I apologize. This lecture is getting very professorial. I really have to apologize. But the subcommittee noted that this was a remarkable opportunity to build a clinically based registry of complaints. Now, this fits quite exactly with what Dr. Bush has just reported from the data subcommittee. And it is laid out for us with Representative Wood's caveat that you have to be careful what data you put into that inductive database. You have to have some controls over it. But before the subcommittee currently, and I'm going to be through in just a second, before the subcommittee currently is a paragraph that suggests that we recommend the creation of a registry based on clinicians' observations on a region by region basis. As think of it as the canary in the coal mine. Think of it as Representative Messmer's observation, Dr. Sherman's observation, that these are clinically relevant findings that ought to be aggregated in a registry somehow, so that rather than waiting for the definitive study to come out of Journal of Infectious Disease or whatever, we can build our own database from what our clinicians are seeing. I think it's an extremely powerful suggestion. I had not anticipated this coming out of the subcommittee, but I think it's necessary for us to examine this as a possibility and to put it in the hands of state government and say, okay, we need to collect these data and from these attempt to build some sense of what risks are out there that haven't yet been identified. Okay. Thank you for listening, and I apologize for going on quite so long.
And I just want to add to that point, that table that we presented,
Yep.
One of the columns is clinical assessment tool,
Yep.
And then where those data may lie in our system. So that's our attempt to do exactly what you're talking about, is to interface those clinician reports or connect them up with what we're concerned about in New Hampshire. And that may be living document, like we said, that adds more as the clinicians feed into that with, possible issues in the state, that would feed into additional lines on that in that data table.
And as Ms. DiTullio points out, this has got to be a dynamic document. It's got to change moment by moment as you get reports in from clinicians.
Bill, would you
Yes.
mind muting?
It's my problem. I'll move to another room.
Okay.
Get to that.
So that's awesome, and thank you, Representative Soloway. Are there any other members of the Education Subcommittee who wanted to chime in? Nancy.
Thank you. To Jeff's point, I know at one of our meetings we had talked about public health officers being very attentive to the risks. And after, Jeff, I don't know, not sure if I sent this email to you, but I made a phone call just here locally to our public health officer just to see, because I think there's a difference in like the larger communities like Manchester and Nashua as opposed to Merrimack. And given the health issues that Merrimack residents are concerned about, and recognizing over the last 5 years, I know a lot of mail and stuff has gone to our public health officer in the town, and we didn't see response to those things. So I was just concerned about expecting our public health officer to be the person attentive to the risks here, even though they know we exist. So I reached out just to get some information about the role of the person in this area as compared to other areas. And I spoke with Erin, who's our local public health officer, and she said many of the public health officers in the state are volunteers. They're not paid. Yep. She was part-time until recently, actually, I think until July. She said 17 of them are self-inspecting, and the difference is, I guess, the setup in each area is different amongst the different officers themselves. She said, a lot of her work is tied up with COVID-19 compliance checks, inspections of pools and daycares, providing educational materials. And I asked her where she gets her information. And like one of the concerns that I had here in this area is she shared that she gets a lot of her information from our polluter, from St. Gobain. And she said Golder sends her emails, which, I think for this community, given the impact that we've had in this town for PFAS, would be concerning to citizens. She said that in the way she gets information, she said it sort of comes to her and stumbles in her lap, and then she saves it according to files based on location. I asked her about her comfort with, being a resource to clinicians around the issues that the area-based health impacts that we have here. And she said, well, with training and that kind of stuff, she probably would be better, but wasn't really, I don't think she felt confident that to be the person that we would to be relied on in this area as the public health person, to be that resource for for clinicians around, to providing findings and that kind of stuff. So I think, it's probably different in different areas, but that's one of the things I think we'd have to really look into and say, if we are going to rely on public health officers, we have to really look at, the ability that they have in time, whether they're full-time, part-time, their backgrounds. She had an undergrad degree in public health, but I just want to be cautious about relying on people that may not be as informed as we need them to be informed if we're going to rely upon them to be the resource for providers. So it was just a thought, that's something that, I think we need to look at in the big picture. I mean, I know we weren't talking just about them being the person being attentive to the risk, but I think it's a great resource, but I just want to feel confident that there's some across the state we're able to do that based on, we're seeing, Seacoast area, certainly with the PFAS, Southern New Hampshire here with PFAS. So I just want to make sure that the people that we're relying upon have the ability and the willingness to be able to do that.
I wonder, a comment.
Yeah.
At this moment, I would have to agree with you that statewide, the core of local public health officers is undeveloped and, dare I say, weak. There is legislation that has been filed in the House that it will come up in this session to organize public health officers and to create a much more professional core of public health officers. And I'm going to ask, but I already know the answer, Representative Murphy, would you support in your own professional and political work the development of a core of public health officers that were really competent to do this kind of work?
Oh, absolutely. Absolutely. I think that what a great local resource. But all right, I just think we're not there yet. So I'm happy to hear something like that happen. Yeah.
Yep.
Great.
Right. I think I'm co-sponsor of that bill. Isn't that bill?
You are. You are. We both are.
Oh, okay. So that's one of the things that I think I hear you saying, Nancy, is that this could be a conduit for dissemination of information, but it probably is not ready to be the only one.
Not really.
Absolutely.
Back to, and I'm not sure whether the education committee subcommittee got into this, is developing ties with organizations and associations that are out there that do this with their members. For example, the Medical Society,
yeah,
the Hospital
Association, yep.
You know, and then all the subspecialty societies that that would be working on this, and especially in primary care. Did you discuss that at all in the subcommittee?
To quote Representative Woods, the devil is in the details. And I think we've gotten to the point where we're considering, as the final paragraph of our report, the general consensus that I think has emerged from the committee that we ought to be developing a means of registry from clinicians, but the details are not there. And I'm confident that I can rely on Representative Woods to help develop that.
I share your confidence. Margaret.
So, so my thoughts in terms of the clinical role here in an area where there are scarce resources.
Yeah.
And, as Representative Murphy has said, an underdeveloped public health service. We have a enormous number of clinicians in the state that really are passionate, I think, about the health of their community members. And to say that they have excess time on their hands would certainly not be accurate. But I think that in education, Dr. Sherman, you could probably speak to the medical physician education better, but I know in nursing education, nurse practitioner education, there certainly is mention of environment. There certainly is an encouragement to ask, but once people get into practice, it seems to fall by the wayside unless you have a special interest in the environment like I do. Those questions just don't get asked. So if we have this army of clinicians that if we were able to in some way increase their awareness, number one, if we did nothing else but increase their awareness that this is an important area for them to understand is impacting the health of their population, and maybe to do something specific with associations that we already know are factual. The association of high arsenic and bladder cancer, and then translating that into what we know about the statistics in New Hampshire. So there certainly are things that we know that we could share. And if we had, say, some members of the commission who would go to the various conferences, all these groups that were mentioned, the Medical Association, the NPs, naturopaths, physician assistants, this covers a lot. And to get a platform to speak at their conferences is really it's a no cost real other than time to share information. It's already an existing platform. And so the only question is, what would we share? What would be appropriate to share? But I think that those systems are already in place, and
Some of them are.
they're all virtual now, of course, but that's okay. You know, I've been involved in presenting at 3 virtual conferences for the nurse practitioners, or for my environmental organization that I'm in. But so it's not difficult to put that in place. But I think that we don't want to miss this opportunity to engage the folks that are in the trenches, who really can then become involved and aware. And so I think that that's really doable, and I would certainly be glad to be involved in that at any point in the future.
That is awesome, awesome feedback. And Margaret, I wouldn't stop at the nurse practitioner level. You know, I've been working with the senior support team, which I co-founded and now chair, which is this group of volunteers that go into all the nursing homes virtually from remote access. We're in 62 facilities across the state right now with about 70 volunteers. And by far, the vast majority are nurses. And their level of engagement and understanding and ability to impart information to the senior residential facilities is unparalleled. And we work along with DHHS just to support the nursing homes. The reason I mention that is you tweaked one of my brain cells on communications and education, which is you and I and the doctors here fully get that the easiest way to get a doctor or a nurse to pay attention is provide free CEUs or CME.
Yeah.
And developing, I'm not saying this, maybe we have the expertise here, but using the data that the data committee brings up that is refined through DHHS, refined through DES, and then turning that into an educational presentation that can garner CEUs, but is talking about, or isn't that what it's called in the nursing world, CEUs, and then EME in the medical world,
right,
would be using the current technology of video and Zoom and all that, and being able to create something that we can disseminate that has that kind of credit attached to it. But addresses this, something Mindy and I have worked on for how long, Mindy? Since at least 2015, trying to get the word out to physicians about PFAS and clinical applications. And I know Nancy's been working on it too. My point is that it's not just PFAS, the clinical implications of environment in the practice of medicine, whether you're a nurse or a doctor or at any level, are real, and they're practical, and they can be taught. And we might get, back when I was in med school, we didn't have any environmental medicine, none.
Yeah.
I remember also prevention, which of course we had none of that either. But now, providing, being a conduit, and this is something I would kick back to the subcommittee to think about, is how do we develop programs? Who would be partners in doing that? I think we have enough information when you think about lead, radon, arsenic, PFAS, and there's a whole bunch more, in GI, manganese, all of these are ones that have clinical implications, both short-term and long-term, that our education subcommittee could dream of ways to disseminate. And the hook is using these ongoing CME and CEU requirements. I've talked too long, so Amy?
No, that's true. It's good.
I was gonna ask Professor Soloway if he knew, I should know, if environmental health is being included in the nursing curriculum. So before nurses hit the field.
Nope.
Because I'm wondering if that's an opportunity as well.
Great point.
Yeah,
You
boy,
know, the other thing I'm thinking about too is Project Echo is expanding through the US. And I just shot a note to Marcy to ask if CEUs are offered as part of the Echo trainings. But that might be another quick win.
Amy, can you, I don't know Project Echo. I probably should.
Okay. Oh, shoot. I was hoping that other people would already know about it, so I didn't have to explain it. But it's the way I think about it is sort of just-in-time training. So for emerging issues, being able to provide web-based training around, like an emerging issue, COVID in nursing homes, and being able to put together a few experts, a couple of case studies, and in short order, being able to provide some quick training on how to manage that particular situation. I will get more intelligent information about Project Echo to Professor Soloway and the rest of this group. But that's the gist of it is, you know, there's not a lot of ramp up time. There's a dire need, and it's been shown to be really effective. It's out of University of New Mexico. That's the end of my
and
knowledge on that.
one of the hubs for Project Echo is UNH.
Yes, it is. They work together with other Project Echo. So there's some that are out of Dartmouth. I understand it's highly collaborative. So if a Project Echo in New Mexico is offering MAT or medication assistance training, they'll share those modules out. But yeah, the Project Echo through the Institute has done a whole array of different types of echoes. And this could be one of them. I think, you know, as Margaret was saying, you know, and others, you know, public health officers, nurses, doctors are very much focused on one thing right now. But when the timing is better, perhaps an environmental health echo or CEUs would be a great opportunity. But I think there's also perhaps an opportunity just to find out what's being offered through UNH and other nursing schools in New Hampshire as far as environmental health.
Great. Any other comments from education subcommittee members? Nancy?
Thank you. I'm delighted that we're at a place where education of health providers is becoming a focus, and I'm so grateful. The House Bill 1538 that I had submitted last session, it was suggested that one of the commissions absorb the work of it, and we had actually done a lot of work. I know Gary and I had met with Mike and Jim over at New Hampshire Medical Society, and we've met with DHHS. So there's a lot of resources seem to be the challenge, getting the CMEs and things out to providers. But certainly, you know, even if we were only able to get information into areas at first, you know, impacted areas at the beginning, that would be great. But I think it was so great. Margaret at our last meeting talked about just how, having been informed by her you know, involvement with this commission, how it changed her practice and the questions that she asks that are just simple questions that give her so much information and allow her to delve into you know, patients' medical histories and maybe further question health situations that they might be in. So we have such a great opportunity. I think, you know, I remember, Tom, the first time I met you was at New Hampshire Medical Society. We were talking about 5 years ago with testing for mom and Merrimack Citizens for Clean Water, testing for peas and Merrimack Citizens for Clean Water, that we were more informed than the health providers in our area. And I think that's changing a little bit, but not enough. So, you know, I'm delighted that we're at the place where you know, we're looking at avenues to make that happen. And those are some great, I want to find out about that Project Echo too. I think we've got some great opportunities. And, you know, just, I was so delighted, Margaret, when you talked at our last meeting about, you know, just the simple little questions that people have no idea why you're asking them what they do in their basement, you know, and how much information that gives you. So it was great. So thank you.
You're welcome.
Well, Nancy, I was just thinking as you were saying that wouldn't it be an exciting evolution of healthcare if as part of the review of systems you did a environmental review as well. So you know,
Absolutely.
a lot of us ask about well water. I ask about well water because of
Yeah.
coliforms and diarrhea,
Yeah.
but I don't ask about well water because of arsenic or lead or any of the others, and probably should be. I'm not primary care, but anyway, that's sort of I think this is an exciting evolution. I think we can have a role in pushing this forward. I would also encourage us to think about partners that we might find in university systems, whether it's UNH or
Yeah.
Dartmouth, for perhaps developing some of this programming coming out of the education subcommittee. In other words, the sky's the limit, Representative Soloway, when you think about how do we best disseminate this? Can we develop a CNB or CEU or both based program that
Yep. Low cost.
low cost, low budget, but
Yep.
those are the places where they can develop those programs and also attach the appropriate credits to them. So
Yep.
I think this is really a huge step for this commission. Comments or questions for or from Education Subcommittee?
Seeing.
I just want to make a comment that I think both subcommittees are doing phenomenal work. And so in the remaining time, I have no objection to ending a little early, but I do want to make sure we have a direction forward. I think the subcommittees are moving forward and should continue continue their work, which is great. I would like to see us continue to meet monthly if that's okay with everyone, or we could have subcommittees meet, but I'd like to keep the momentum going. And we also have, from Katie's work, or Katie's report, we have several presentations that we're looking for. I don't know if you can bring that back up, Katie, the thoughts on, wasn't that your slide that had the thoughts on presenters?
And Representative Sherman, while she's doing that, or Senator Sherman, while she's doing that, do we have the dates for January and February?
No, the problem is, of course, we're getting into the legislative session. So these Tuesday meetings, it is Tuesday, right? The beauty of Zoom is that every day becomes one, and who knows where I am at what time, but
I think that's the whole pandemic, not just Zoom.
yeah. So, but I think we would go back to preferentially being on Fridays, if that works for people. Mondays are my work, so
Friday's good.
do Mondays. We might be able to meet in, let's see, early January on a Tuesday, but I just don't know what the committee schedule is going to be like. Representative Soloway or any of the state reps, do you guys have any clue what your committee schedules are going to be like for January?
Historically, it's been Tuesday and Wednesday for committee meetings and Thursday for full house, but I just can't imagine how we will manage full house on Thursdays. I think your earlier suggestion of Friday meetings makes a lot of sense.
Okay, all right. So let's just, I guess, do one thing at a time. Is everybody pretty much available on Friday mornings?
Mm-hmm.
Yep.
Is that, so I have, and maybe some of you also have it, the Shawship Commission, unless the House effort to repeal that commission goes, which would be a disaster, goes through. Just a little political commentary. That commission, by the way, which is called State Health Assessment, State Health Improvement Plan Advisory Council, as Dr. Bush knows, is one of the most critical public health efforts being made in the state, and really dovetails with what we're doing here. So to any House members on this call, I hope you will make every effort to not let that bill move forward that would repeal the state health assessment, state health improvement plan. It's just critical. And it's also pretty much a requirement. In any case, that's on Friday mornings. That's, I think, the fourth Friday that, or let's see, it's not this week, but it's next week. So how do people feel about the second Friday of the month?
Is that the 8th or the 15th, Senator?
That would be the 8th. Is
Got
that
it.
the-
You got it.
Can I just ask Gary Woods, do we know if the 737 commissions are going to be on, which Fridays they're going to be on? Have you heard? Okay,
No, not that I'm aware of yet.
okay.
I'm on. It's on
Okay,
my
yep,
calendar.
I can also do, it looks like the state health improvement is on the 15th. The 22nd is currently open. That would give us a little more time to get geared up for that meeting.
If you want to have a presentation, I
Right.
can see if the 8th or the 22nd are available. I'm thinking, Katie, that it would be Chow Wei or
David Wieters.
David Wieters. Yeah.
Could we get 2 presentations? Because we have, what did we have, Katie? Did you have 5? You want to try to do a couple of presentations per meeting, or do we want to do a presentation then have free-ranging discussions?
I think the only one, I don't know who could coordinate one with Department of Ed. I'm not sure exactly who a person would be. So I think the 2 right now that are really on the table are these 2. And I haven't yet really gotten to connect with the birth defects folks. So I could keep you all posted. They're currently sort of really working hard on their grant renewal. So
the trace study, how about if, Amy, what if we did the 22nd and the agenda would be, are the subcommittees hoping to meet before the 22nd?
Yes.
Would
Yes,
we,
absolutely.
would we want to do one presentation with the EBI and then have subcommittee updates? And so we could do the presentation plus discussion.
Okay.
and
Subcommittee updates.
Plus discussion. Would that
Okay.
be a full enough agenda for
Oh
everybody?
boy, that's enough. And you want that on the 22nd?
I'm just thinking the 8th is awfully short
It's
notice.
close. Sure.
We're putting together a presentation. What are your thoughts, Amy?
I think they've been presenting around the state fairly often, so that it may be somewhat canned, but I would like, I can feel him out. If he says the 20th is terrible, I'll ask him if the 8th is possible.
Okay, so why don't we?
Or some other date.
But let's try to get an answer in the next 48 hours or so.
I'm writing the email right now.
Okay, perfect. I love people who can multitask. Does that fit
will
for?
you CC me on that as an internal sort of protocol?
Sure.
Does that fit for everybody?
Yeah, it's on my calendar. Ready to go.
Okay, so it's 8th or 22nd, and we'll know within 48 hours which one.
Do our best.
As best as we can. Yeah, and just remember, we have to have, Alan, what do we need, 2 weeks notice for the calendar?
So we're going to be back in session, so it should be every week. So a week's notice, I think, should be enough.
Okay. But I don't want
to. We got to figure out also what the meeting times. We got to just talk to the new majority, and see what their plan is for it, and make sure that they're not planning to schedule things on those dates.
Okay, and that reminds me, if we leave basically an open window of 9 to 12 on those mornings, it would be either 9 to 11 or 10 to 12. Is that okay with people? So we'll leave it flux until we hear back from Alan, and Alan and I will coordinate for that next meeting after we hear back from Amy. and Katie. Right. Sounds good.
Great. I'll copy you on this too, Tom.
Okay, thanks. Any other discussion for today? This has been awesome. So action items, we have subcommittees continuing to do their phenomenal work. A semi assignment for the education committee to think about taking some of the stuff that we now know and develop an environmental curriculum for CME, for continuing education credit. Maybe thinking about partners and Amy and others who might have ties with universities, thinking about whether there's anyone that we could use as a resource. And then we'll reconvene. The other action item is to set up the presentation for the next meeting. Is there anything else that I'm missing? Cool. And Alan, if my feeble memory doesn't fail me, we don't need to do a roll call to close the meeting, correct?
Yes, you do, actually.
Darn, my feeble memory did. Okay.
Motion to approve.
Motion to adjourn?
Motion to adjourn. So moved.
We have a second.
Second.
Okay, we'll take Representative Nelson and Representative Soloway. So let me find my right to know script. So there we are. Okay. Representative Soloway.
Yes.
Representative Woods.
Yes.
Representative Nelson.
Yes.
Representative McMahon.
Yes.
Me, yes. Dr. Bush.
Yes.
Amy Costello.
Yes.
Margaret.
Yes?
Mindy.
Yes.
Nancy.
Yes.
Did I miss anybody? Okay, everybody, thank you so much for this incredible work and the wonderful discussion. I think if you look back over the history of this, whether it's 5/11 or current, I think we are really making incredible progress. And so it's thrilling to watch. And I think we have a bright future together. So with
Yes.
that, have a wonderful,
Oh, Gary,
wonderful, safe holiday.
Gary,
Oh, thank you.
If I could just make a comment.
Yeah.
It's very heartening to see the coalescence of data. I'm harking back to when Judd Gregg was governor. There was a Blue Ribbon Commission, which I served on. Out of that, we came up with two points that needed to be satisfied. One was the improvement of data and the collection of data from all the resources which were fragmented. So finally seeing it from Judd Gregg's commission to now finally taking place.
That's 30 years ago.
The wheels move slowly, but they move. Yeah.
Bye, everybody.
Any other comments? All right. Thanks, everybody.
thank you.
Bye, everybody.
Happy holidays. Take care.
Merry Christmas.